6 on your side at 6 starts now.
Hi, I'm Governor Brad Little. My fellow Idahoans, I want to reach out personally to let you know Idaho is carefully and closely monitoring the novel coronavirus.
Heads of Idaho government come together to let us all know health and education leaders are on the case and preparing for a likely outbreak of the COVID-19 or coronavirus. Good evening. Thanks for joining us. I'm Don Nelson. Governor Brad Little announces a task force to help gather information about coronavirus and to let everybody know how you and all Idahoans can help slow the spread of the disease. Right now, your individual risk of catching the disease is low. But health experts expect the virus to spread. Today, California reported its first death, Washington State its 10th. So far, Idaho does not have any confirmed cases of the coronavirus, but public health officials have monitored 35 different people with more tests expected today. Health officials have been monitoring the virus in Idaho since the beginning of January. The public goal for the governor's work group is to slow the spread.
This group was created specifically for that purpose, to make sure that we are coordinated, that we're proactive, and we are prepared at the state and local level to respond for any situation that should occur in conjunction with the coronavirus.
All the leaders stress the importance of practicing good hygiene. The public is asked to do their part to stop the spread by washing their hands frequently and staying home if you are sick. Idaho State epidemiologist says the science suggests 80% of the people who get the coronavirus will have a mild illness and recover just fine. She also told us parents with healthy children should not be concerned. Older people with health problems have the highest risk. She says she does have some concerns and doesn't think there will be a cure for at least a year. She also pointed out that there will be several challenges ahead because this virus is new.
We can't predict where this is going. I think potentially this is the biggest event since I've been here in '95, and I remember we had West Nile arrive, and you guys might remember that was 2006. That was rough. We had a lot of people in the hospital, but this has the potential to be more impactful than any of those as regards to impact on our healthcare system.
Hahn says the coronavirus is more infectious than the regular flu, but the incubation period is longer and that it gives the virus more time to spread. Health leaders say the last thing they need is people suffering from small symptoms or breathing problems to overcrowd the hospital system. That's why they developed a website to provide continuous updates on the coronavirus in Idaho. Here's a look at that site. It has data on COVID-19 monitoring and testing and a link to show where the most infected areas in the world are located. We'll have a link to this site for you at 6onyourside.com. Governor Little echoing sentiment coming from global and national health leaders. Don't overreact and buy up medical masks and unnecessary personal protective equipment.
But it's even more important now with this issue right on our doorstep. So it's capacity. So if you buy all the hand sanitizer and you buy all the masks, you're actually doing yourself a disfavor because, as if you read Dr. Pate's article this morning, that really doesn't do you much good if everybody else around you is sick.
The World Health Organization has warned of a global shortage in medical equipment. The shortage could leave health workers all around the world fighting the virus unprotected. The WHO has sent out 500,000 sets of protective gear, but those supplies are already running out. Estimates say governments and manufacturers need to increase stocks of protective equipment by 40% to meet bare minimum requirements. Shelves in several Boise stores are being emptied. People are stocking up on bottled water, bleach, disinfectant wipes, toilet paper, and other emergency supplies. The reason? Many are worried, likely as a result of misinformation that they are hearing. That's one reason the Southwest District Health Department set up a call center and hotline as of today to help you get accurate and reliable answers to any coronavirus questions you may have.
If there is calls that they aren't able to answer the questions, they can take a note and pass it off to the epidemiology team so we can call those people back and answer their questions.
Health experts will answer your calls from 8 in the morning till 8 in the evening, Monday through Friday. That number on your screen, 208-455-5411. What if coronavirus makes its way into our schools? Would they close for extended periods, and would every student have to go into quarantine? That's what 6 on Your Side asked local districts. 6 on Your Side's Jessica Taylor explains how schools are keeping the teachers and parents up to date.
Dawn, Central District Health says younger people like school-aged kids are not the most at risk for this strain of coronavirus, but still it's best for school districts to be prepared anyways, especially if teachers or other faculty potentially come down with it. I spoke with Boise and West Ada school districts about the plans they have in place.
We're planning for the worst, but hoping for the best.
No confirmed cases, but prevention protocols and preparations at West Ada and Boise school districts are underway. Boise School District is sending this information to parents, saying in part they'll provide information on how to continue education if extended absences or school closures occur.
If we did happen to have a confirmed case, there would be precautions that were taken for isolation. There would be actually probably testing done for immediate response, and that's a typical epidemiological response.
West Ada says they have a weekly task force meeting on this topic, and starting now, they're sending information to parents every week on COVID-19 preparations.
A lot of it initially is education, but as any of our operations change, we will be communicating that with parents weekly.
West Ada is using their pandemic plan they developed 11 years ago, updating it as needed since every virus and infection is slightly different.
All that we know is that we'll have to be flexible on absence policies. We've already started tracking anybody who is reporting an absence related to COVID-19 in any way. So we are actually marking that out.
Central District Health says coronavirus is nothing new and ultimately less deadly than the seasonal flu. It's just this particular strain that's raising eyebrows. They'll continue working with districts and the CDC to provide the most up-to-date protocols.
If you feel sick, if you're running a fever, don't go out in a public space.
The schools are already increasing cleanings and the hand sanitizer available for students, since the virus can't live on surfaces which are disinfected regularly.
It's worth being prepared even if you don't have to implement everything that you've thought through that you might have to implement.
Xline also told me that there are 2 phases in case this disease makes its way to the schools. They're in phase 1 right now, which basically is spraying sanitizer, educating kids on basic hygiene, and deep cleaning schools. Phase 2 would go into effect if there's actual confirmed cases, and that would break down how they'll be classifying absences, providing educational services if schools close, and even payroll if their staff can't work in the same building. Again, this is all worst case scenario. None of phase 2 is in effect right now. Reporting live in studio, Jessica Taylor, 6 on your side.
Spring break is right around the corner, and the spread of the coronavirus has many rethinking travel plans. Obviously, there is a lot to consider, and the CDC and the State Department are updating travel advisories frequently. Right now, China at a level 4, which means do not travel there. Italy and South Korea are at a level 3, which means you should reconsider travel. In addition to sickness, they say you should take into account the potential inconvenience of being stranded by a closed border or having to face a quarantine. You can check the State Department website for any updates on those advisories. Though if you do decide to change plans, here are some tips to ease short-term pain. Right now, more airlines are starting to waive change and cancellation fees. This varies on when you booked and when you're traveling and where you're going, of course. Hotels and rental cars are more flexible with cancellation policies. Airbnb varies with property hosts. They may offer full refunds or charge a service fee just to cancel. Also, check with your credit card company. Some have trip cancellation and interruption benefits and may reimburse non-refundable reservations. Again, we know this is a lot to digest. The big takeaway here is the sky is not falling. Idaho government leaders are working with the federal government to keep coronavirus out of the Gem State and ensure the safety of all Idahoans. But the main goal for local healthcare providers is to slow the spread once the virus appears in Idaho. So wash your hands well and often. Avoid contact with people who may be sick, and if you are sick, stay home. If you'd like more information, just head to 6onyourside.com, click on coronavirus, or download our app to stay informed on the go wherever you go.